Hello, this is Dr. Behnam. I'm a board-certified dermatologist and I practice in the beautiful Santa Monica, California. Today we're going to be talking about acne and the various treatments for acne. So there are many different forms of acne. One of the most common forms is what we call papular acne. These are the red pimples that people usually get on their face. We also have what we call whiteheads and blackheads, also known as comedones. These are the acnes that are underneath the skin. And then we also have cystic acne. These are the cysts that people have on their face. So when somebody comes into the office for an acne consultation, you want to divide the acne into whether if it's just comedonal, the whiteheads or the blackheads, red pimples, which is known as papular acne, or cystic acne. If some patients just have whiteheads and blackheads, the treatment of choice is an exfoliating cream such as retin-A or different. These basically unplug the pores, let the skin breathe, and basically reduce the comedones on the face. Patients have to use the retin-A or different every night, and about 6 weeks you're going to get about 30 to 40% improvement. Some patients are very sensitive to these retinoid creams. As a result, I highly recommend that patients use it very sparingly, literally a pea-sized amount, and just gently put it on their face, tiny bit, and massage it in. And also start out using it every night. So you start out using it Monday, Wednesday, Friday, and then slowly and gradually you add additional nights. So by the time the second month comes around, at the end of the second month, you're practically doing it every night. Doing it this gradual process is going to prevent the irritation that some patients get on their face. Also, using a retin-A, some patients' acne could get worse initially, but then later on it's going to clear up. For patients who have the papular acne, these are the ones with the red pimples on the face, the treatment of choice is typically an oral antibiotic. There are many versions of the oral antibiotics that we use. They're typically part of the class of family called tetracyclines. So we have patients either take doxycycline or minocycline. It's typically taken once a day with food. If you take it without food, it's going to cause upset stomach and heartburn. I typically tell patients to avoid drinking milk or taking either calcium products or iron products an hour before and after taking the medication. Also, both the doxycycline and minocycline will make you sun sensitive, so please stay out of the sun. So a patient that comes with red pimples, I typically put them on an oral antibiotic plus a topical antibiotic such as clindamycin. DUAC is an example of a combination of a topical antibiotic such as clindamycin and topical benzoyl peroxide. So typically I have the patients do the topical DUAC as well as the oral antibiotic like doxycycline. Now most patients that actually come in have a combination of the whiteheads as well as the red inflammatory pimples. So in those cases, I start the patients on DUAC gel in the morning, which is topical clindamycin, do a form of retinoid like a retin-A or different at night very sparingly on the face, and then take a pill doxycycline or minocycline once a day. This is known as a triple combo, and patients that do it 2 to 3 months, at the end of the third month, they're going to get a significant improvement. Patients that have chest and back acne definitely have to go on oral antibiotic. These are one of the most resistant forms of acne. So antibiotic is definitely warranted in those cases. Patients that present with cystic acne typically have to go on Accutane. Please watch our video on Accutane for more information regarding that. Accutane, in short, is basically taken once a day, depending on the dosage, and patients typically take it for 5 months. There are side effects with Accutane, so patients have to be very careful and have to have their labs checked regularly on a monthly basis. Again, this is Dr. Behnam. I'm a board-certified dermatologist, and this topic was about acne, various types of acne, and various modalities of treatments for acne. If you have any questions, feel free to visit our website, santamonicaskin.com. Have a nice day.